Hello teacher, my name is Javier Guajardo and together with Ignacia Machuca and Josefa Christoforou, in this video we will talk about COPD, the nursing interventions for this disease and the expected results after our care. What is COPD? Chronic obstructive pulmonary disease is a common pathology that reduces airflow and causes breathing problems. The airflow obstruction is usually progressive and is accompanied by inflammatory responses to noxious particles or gases. The main cause of this disease is smoking. This pathology can present in two forms: chronic bronchitis, which is characterized by increased mucus production and the patient has a persistent chronic productive cough, and emphysema is when there is destruction of the pulmonary parenchyma and loss of its elasticity.
The nurse interventions for chronic obstructive disease are: the first, patient education. Provide information about the disease, like symptoms, signs, treatments, triggers, and how to manage it in daily life. Second, evaluate the correct technique of oxygen therapy, like nose pads, venturi, and reservoir mask. What is the best option for the treatment? It's very important to the control of dyspnea by monitoring vital signs and gases. And it's very important the control of triggers like air pollution, smoke, and allergens. And finally, the work is not just for the nurse. The visit be must coordinated by the nurse for the medical attention, kinesiology attention, and other specialties.
Interventions for patients with COPD may include pharmacological measures such as bronchodilator, which are medications that help relax the muscles in the airways, making breathing easier, and inhaled steroids that help reduce inflammation in the airways, as well as non-pharmacological therapies such as oxygen therapy, in which supplemental oxygen is administered to improve blood oxygenation in patients with low blood oxygen levels, pulmonary rehabilitation, which includes physical exercise, education about the disease, training in techniques, breathing, and psychological support, and lifestyle modifications to reduce risk factors such as smoking and smoke exposure.
As a final conclusion, we can say that COPD is a serious pathology that progressively affects our lungs and respiratory tract. It is important that people become aware of the smoking habit, since it is the main cause of the disease. Thanks to our intervention, we can make patients reflect on the damage caused and promote a healthier lifestyle. Thanks for your attention.